Welcome to AutismSpa.com. I am Shahriar Afshar, your host and the executive director of our sponsor, the Autism Society of San Diego. We're honored to have Dr. Charmi Patel Rao with us today. She's also one of our featured speaker during our February 7th conference here in San Diego. So if you are able to still get a ticket, please do so. Tickets are going fast if they're not sold out already. We really wanted to hear from a psychiatrist with knowledge and insights and experience into treating autism spectrum disorder, because really a lot of our community is always asking me, at least talking with a lot of our board members about the role of psychiatrists, therapists, psychologists. It really can be overwhelming. Now, not every parent is a veteran 10, 20-year, 30-year parent of an autistic child. So a lot of parents are new to this. They're learning on the job. We're all making it up as we go along. And I always say, and we always say this in our support groups, that no matter what psychology and psychiatric aid is available, nothing replaces, a parent's love and support in the home. That is just transcends everything around us, and that really drives the health and well-being of our kids. So with all that said, I wanted to welcome Dr. Rao to our program and ask her to introduce herself. How did you get into this field? And then how did you kind of go into treatment of ASD?
Thank you. Thank you for having me here. So I'm a child psychiatrist and adult psychiatrist, trained here at UCSD. And, I think I always knew I wanted to work in the helping profession, and knew early in medical school that I wanted to work with children and families. I was drawn to psychiatry, kind of the broad subject of psychiatry, because it felt like being a detective, where you have to talk to the patient in order to understand what was going on. You can't just order an imaging test or lab work or do surgery to fix the problem. And then when I completed my child psychiatry training here in San Diego, one of my first jobs was working with children with developmental delays and co-occurring mental health concerns. First in a kind of the San Diego Unified School District, and then in a non-public school. And that quickly became an area of interest and expertise for me. I was actually the psychiatrist at the Stein Education Center, which is a non-public school for students with moderate to severe developmental disabilities, for 10 years. And it was such a rewarding experience. So that's what drew me to this field.
I mean, good for you. I mean, I can tell you as a parent, it can be frustrating, not only, trying to manage behaviors if they're severe enough, but to try to teach them, and overcome those behaviors. Every parent I know is exhausted. I don't know any I see energetic parents, and I'm always in awe of how they're able to do that. But sometimes one parent or both end up becoming the healthcare providers or managers.
Right. Having to quit their jobs to
right. It's so overwhelming, the paperwork and the scheduling and the appointments.
Absolutely.
And of course, many of them do go to psychiatry at some point. Their pediatrician or their other doctor says, if you want to see a psychiatrist, there are some medications that may help. So, take us through that journey, because that doesn't always happen. That's not, you're not the first responder. The pediatrician, there's a process where people come to you. And how do parents reach that process? And what do you tell them when you first kind of see a child?
Right. So, first of all, I would say that many children and young adults with autism don't ever see a psychiatrist, right? There aren't medicines to treat the core symptoms of autism. And so, we're talking about a subpopulation of the autistic population who might end up seeing a psychiatrist if there's a concern about a co-occurring mental health concern, right? And so we think of psychiatrists along with neurologists, developmental behavioral pediatricians, as primarily having a role of managing medication for patients with autism. But I think of our role as being broader than that. And I think it behooves us as kind of trusted providers to know about other interventions that can be helpful for the population to be able to guide the families that we work with. So I personally think it's important for adult and child trained psychiatrists to be well versed in screening for autism. This comes up even for adult psychiatrists, where patients will come in and talk about having concerns about being on the spectrum as an adult. So I think it's important that, that psychiatrists are well versed in screening for autism. And then also knowing how treating autistic patients is different than treating like a neurotypical patient, right? I think it's important to understand that as well. As you said,
let's talk about the adult diagnosis, and then we'll talk about the difference between neurotypical and neurodivergent diagnosis. But we see a lot of adults in our support groups who have just been diagnosed, and they're going through this identity crisis.
Right.
They didn't know. Some of them were diagnosed as a child. Their parents never told them for one reason or another.
Well, that's
can you imagine? So that happens. But usually it's a young adult, and they're someone in their 20s, sometimes 30s, 40s, who, after some therapy and various mental health support, comes to that diagnosis, and then,
or sometimes they've had their own children who've been diagnosed, and then they realize, going through that process that they have.
And how do you work with an adult that's come to that realization? And are there, medications to help? Probably there'll be anxiety, there's some depression, there's all kinds of reactions to suddenly realizing, you're kind of, you're special,
Right. I think, we talk often about when families first have a child who's diagnosed with autism, there is a process, whether there's a grieving process, right? My child is not going to be who I thought they were going to be. Kind of developing a change in expectations and acceptance process. So we talk about that for families with children who get diagnosed with autism. I think adults who get diagnosed with autism go through a similar process for themselves. Okay. And I think, we have to, whoever is involved, whether it's a psychiatrist or a support group, I think supporting that person through that process as a first step is important before thinking about intervention, right? Before jumping into intervention. I think with kids, we want to jump in with intervention quickly because there's a time sensitivity, right? We always talk about early intervention is important. But I think with adults, I think you have that luxury of time to really let that process happen, whether it's grieving, acceptance, joy. Some adults feel joy. I finally understand myself. I finally have a label for what I've been feeling. I finally feel included and accepted. So I think giving time for that is important.
Right. Thanks for mentioning the grieving process, because it's real. And we've also noticed in our support groups that men and women go through the grieving process differently.
Yeah.
Right. They have a different process of grieving and accepting and overcoming with the right support. I can tell you, and I always say this because it was very eye-opening for me, a young mom in one of our support groups who has a child on the spectrum. She was crying. She was very emotional, but she wasn't sad because she wasn't grieving because of her child's diagnosis. She thought she wasn't enough. She thought she wasn't doing enough. Right, which happens, right? Young moms, typical kids, you feel like, am I doing enough for my kid? Am I getting him the right school? When you are dealing with this, it's extra overwhelming. Right. Am I doing enough? And for everybody, and dads, in some degree, they can't fix this. They're fixers, right? We fix things. This isn't something you want to fix. And to be able to accept your child unconditionally is a process that men and women seem to go through differently at different paces, right? So they may need their own help, not only the child or young adult that's diagnosed, but the support groups around them, the parents, either two dads or two moms or what have you, process it differently.
Right. And I think I think these support groups have such an important role, whether somebody's in a kind of organized support group like an Autism Society or just has friends who have kids also on the spectrum and kind of informally make their own support group. I think it's so helpful to just feel like, this other person gets it, right? I don't have to explain it. They just understand what's going on or why my child is doing whatever they're doing. I think you also touched on, parents feeling like they're enough. And I know we'll probably talk about intervention a little bit later, but I think it's so important that parents are part of the intervention, that it's not just focused on the child, but that parents are part of the intervention as well, so that they feel empowered, that they are enough, that they can raise their child and teach their child and help their child be the best version of themselves. So.
Right. No, that's a process. I mean, it's definitely, I mean, the label and stigma that society has put on autism, can be intimidating if you're not prepared for it, and then to be able to have the emotional support to move forward. You started to mention, treating neurotypical, let's say, patients with neurodivergent patients, and obviously I mean, some are verbal, some are not. They all have different behaviors. I mean, what is the difference between the two different types of patients? And then we'll talk about maybe how you typically treat neurodivergent patients.
So, I mean, mental health diagnoses can present differently in somebody who has autism versus a neurotypical patient. And then, to add more complication to that, autistic patients might respond differently to medication if they are being prescribed medication, or be more likely to experience side effects from medications than patients who don't have autism. So a psychiatrist or anybody providing those medications has to keep all that in mind. I think, for anybody who's working with autistic patients, it's important to kind of think about more broadly in terms of your office space, right? Your office setting. We talk often about encouraging families to have the first appointment of the day or the last appointment of the day, so the waiting room isn't as crowded. I think it's important for there to be access to fidgets or other preferred activities to help the individual feel comfortable. I will often ask families, what does your child like to do, or can you bring a preferred activity with them or snacks with them? I think this is especially important for initial appointments. In psychiatry, the initial appointment can be an hour to 2 hours. I will sometimes try to break it up if possible and have one appointment with just the family to kind of understand the history, the concerns, and then the second appointment with the child, so that the child's not having to sit as long for that appointment. Whether a child is on the spectrum or not, kids have a hard time hearing their parents talk negatively about them. And when you go to a psychiatrist, you have concerns, right? You're concerned about behavior or not completing things that they're supposed to be doing. And so that's hard for kids to hear. And so if there's a way to talk about those concerns with the psychiatrist without the child there, that can be helpful. Or I'll ask if it's possible for the family to have two adults accompany for an initial appointment. So if the child needs a break, then there's an adult who can kind of walk around with them or take them to the waiting room for a little bit. Just those logistical things that we don't always think of for a neurotypical patient, but that could be helpful to make a good appointment, because I have had the experience where if the first appointment doesn't go well, the child refuses to come back. And then what do you do, right? I mean, so you want to make sure they have a comfortable experience the first time and are willing to come back again, right, for ongoing care. The other thing I was going to say is, if you have a verbal person with autism who's participating in individual therapy, I think that can look a little bit different too than therapy with a neurotypical client. I think involving parents can be helpful. A lot of times when, especially for teenagers and young adults, you don't think about involving parents in therapy, but I think that can be helpful for the autistic population. It could also be helpful to repeat things or write things down so that it's able to be retained more quickly, right? Because we know generalization can be hard sometimes for people on the spectrum. So.
No, that's, I had a flashback as you were talking, because all of those things have happened to me as I'm taking my son to his appointments. It's a new environment. He doesn't want to sit around. It's a small room. I mean, let's be honest, I don't like small rooms.
Right.
So who does? Especially, a kind of sterile environment. I know psychiatrists, sometimes it's a little bit warmer than a medical exam room, so it's different. But all those things are true. And I think the last few times I've been over, first of all, virtual appointments help.
They do help. I often like the first appointment to be in person,
Right.
and then I will agree to do virtual appointments. But yes, virtual
Right.
appointments.
So we've had to do that obviously during COVID. If my son doesn't like an environment, we're pacing. But we're not sitting in a chair comfortably. We're pacing and we're getting a little nervous. We're trying to get out the door. We can bribe him with candy or different treats to buy some time, but it's very limited. Usually it's just the opportunity for the doctor to physically see him or her
Mhm.
and maybe check him out and make sure he's doing fine, and then they'll release him with maybe my nanny or aide or somebody or another parent to go into the parking lot or sit in the car, the comfort zone,
Right.
because that environment is so that's it's kind of severe level 3 behavior, high support needs. But I've also observed, and I would love your feedback on this, that some verbal younger children don't like to be labeled as autistic, and they
Mhm.
don't like to be discussed, as an autistic person. They fight back vigorously, as they should. They have their own identity, whatever they choose to um, assert. I
Mhm.
think parents and everyone should support. So, how do you deal with that? Someone that doesn't that rejects that label.
Um, it's interesting because I think what I've seen, well, backing up a little bit, is that kind of question of when to share the diagnosis
Right.
with your child, right? At what age, and I think it depends on the child, and I think it depends on the parents too, right? Because I think parents have to be at a point where they can sort of be a little bit neutral as they're describing it, and not kind of pouring their grief to the child, because the child might not see it that way. But I've seen people change how they relate to autism over time, right? They might reject it when they're younger. And then as they get older, they see some of the benefits of it, or they learn about famous people who also have autism, or they watch shows where, they're seeing autistic individuals struggling with things and overcoming things, and so it kind of changes their relationship with it over time. Um, so yeah, I think I think you have to just meet the child where they're at, right? And that it kind of speaks even to what we talk about when we talk about language matters, right? So is it person first, or not, right? So is it a person with autism or an autistic person? And I think it depends on the individual, so
Right.
when I have a verbal patient in front of me, I ask them what they prefer. When I'm presenting or talking, I interchangeably use both, just to kind of make sure I'm covering both. So I think there's no right answer to it. I think it depends on the child,
Right.
right? And meeting the child and the family where they're at.
Even the decision to go to a psychiatrist to possibly seek medication was a tough one. It was a tough one for my family. I'm sure it's a tough one for any family struggling, because there's reaching a point, as for example, we did, where the school was saying, we can't contain him, we can't teach him, we can't do ABA, he doesn't sit still, you need to do something. They don't tell us, but that's kind of what that means. Either
It's
you can't come
code.
to the school, yeah, it's code. Either you can't come to the school, or if you want him to come to school, he needs to sit and be able to, and this was a private placement. It was a special, so even they had limitations.
Mhm.
So I know some families choose for various personal reasons not to accept any medication, and others choose it. And then my question has always been, what's the balance? Because sometimes I ask the psychiatrist, are we over medicating? I don't want him to lose, at least for my son as an example, I don't want him to not be himself. So if he's mad at something, he needs to be able to be mad. If he's happy, he needs to be, I'm not going to medicate him because I simply don't, I want some peace and quiet. So it was very important to me, at least in my decision to tell the psychiatrist, that is only to control his behaviors that was a safety issue,
Mhm.
that impeded his
Absolutely.
education, that caused, for self-injury to, potentially hurting others, eloping, anxiety, all kinds. Sleep was a big issue, right? I only wanted minimally to medicate him to be able to contain those behaviors, but I didn't want him not be himself.
Mhm.
Do you have that conversation with parents about what is the balance?
No, absolutely. And not just with parents of autistic kids, right? I think it's even something that comes up if a child is presenting with ADHD or an anxiety. And, like we want to make sure the medicine's not going to, numb who they are or change who they are, right? To change their personality. So that's very much a common concern that comes up. And just to reiterate, there are no medicines to treat the core symptoms of anxiety. So the role that a psychiatrist could play is to figure out, is there a co-occurring, mental health concern like anxiety, depression, ADHD, or are the symptoms that the child is presenting with part of their autism, right? And then, so that's one thing that the psychiatrist can help tease out. And then you want to look at, what's the level of impairment? And you were talking about this, from those symptoms. So is it making it difficult to go to school or be able to be successful as possible at school? Is there a safety concern? Either, is there self-injurious behavior or aggression towards others? Is there a safety concern in terms of eloping? Some of those things are behaviors that are seen, that are manifested. And it's important to kind of think back, peel the onion or look under the iceberg. There's all these analogies about this. What's causing that, right? Because if we're thinking about medication, we want to know what's causing the symptom so that we can use the appropriate medication for it. So is it anxiety that's causing them to elope, or is it impulsivity that's causing them to elope? The medicine would be different depending on which one it is. And so that's part of what a psychiatrist is doing, is to help tease that out. It can be tricky often, I think, and especially if you have a nonverbal patient, it's especially tricky because you have to look at other signs, mental status exam signs from the patient. You have to obviously talk to the parents, but even get collateral from other, respite care providers or the school or other, other providers, other family members. And because again, it impacts what you're thinking about in terms of intervention, whether it's a medication or non-medication approach. I was going to say, it's also important for a psychiatrist, patients or families trust their doctors, right? Whether it's a pediatrician, psychiatrist, whoever they're seeing, they trust their doctors, in terms of recommending treatment options. So I think it's so important. Not just the psychiatrists are well-versed when it comes to medications, but non-medication options. And we're not going to be experts on everything, right? But we need to know enough about the different intervention options for autism, so including behavioral therapy, developmental relationship-based interventions, occupational therapy, social skills groups, the gamut, right, of the options that are available. Psychiatrists should also know the role that regional center can play and school-based interventions so to help guide families to know when to seek those supports, right? We want to make sure families are going down the right path and not spending time going down a path that's not the right answer for their child or not a viable answer for their child. So, I think those things are important too for a psychiatrist to have at least a basic understanding of.
Well, we ran out of time, but we could speak for hours. I'm so glad you're going to be speaking at our February 7th conference in San Diego. So important. Please come back and join us, Dr. Charmi Patel Rao, psychiatrist, and just a wonderful human being, clearly. So I'm so glad you're treating our kids, and I feel a little bit better knowing that caring professionals are looking after our kids. Thank you so much for joining us.
Thank you for having me.